Hey everyone, today I'll be talking about on approaching a patient with abdominal injury. Now, abdominal injury can be of two types, whether it is a blunt trauma or it is a penetrating trauma. First, I will be talking about is the blunt trauma. In blunt trauma, we first need to see whether the patient is going in shock or not, or say the patient is hemodynamically stable or not. If the patient is going in shock, then we immediately need to go for exploratory laparotomy. But if the patient is not going in shock or he or she is hemodynamically stable, then the first investigation that we do is FAST, which stands for Focused Assessment with Sonography in Trauma. Nowadays, what we do is actually EFAST, which stands for Extended Focused Assessment with Sonography in Trauma. Now, before proceeding, I will be talking about FAST in brief. In FAST, we put the sonography probe at 4 places, and whenever we do EFAST, we put it in 6 places. So the first space is the perihepatic area, which is also known as the Morrison's pouch. Second, where we put the probe is the perisplenic area. Third, where we put the probe is the pelvic area, and specifically we focus on the pouch of Douglas. Fourth, where I put the probe is the epigastric area. And when we are doing EFAST, we also put the probe on the right lung and the left lung. Now, after performing EFAST, the next investigation or the investigation of choice is contrast enhanced CT scan. In CECT, what we look at is viscera injury. If there is no viscera injury, then we just observe the patient. If there is a viscera injury, then we see whether it is a hollow viscous or a solid viscous injury. If it is a hollow viscous injury, then we go for exploratory laparotomy. And if it is a solid viscera injury, then we go for the grade wise management. Next, what I will be talking about is penetrating trauma. Now again, penetrating trauma can be either a gunshot injury or a stab injury. If it is a gunshot injury, then we immediately need to go for exploratory laparotomy. But if it is a stab injury, then we need to look whether the patient is going in shock or not. If the patient is going in shock, then again we go for exploratory laparotomy. But if the patient is not going in shock, or say the patient is hemodynamically stable, then here again the investigation that we do, or say the investigation of choice, would be CECT, wherein what we look at is peritoneal breach. If there is no peritoneal breach, then we simply go for wound closure. But if there is a peritoneal breach, then we go for exploratory laparotomy. So this was all about approaching to a patient with abdominal injury. Here is the overview. If you like this video, make sure you like this video, share this video and subscribe to our channel. Thank you.